crazy. And we are live. Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer, and we are on November 3rd, 2020, election night, the United States of America. Decided to put on a little blue, a little bit of white, wee bit of red lipstick. I don't know if anyone can hear me, but I figured let me just come on tonight. Election 2020. I see two people on. I'm always excited when at least one person is on. I feel I'm not alone, but I just could not resist to just come on and just have a little chat about election night 2020. So here we are and I hope those of you who are joining, you're in a safe place, safe with regard to this COVID quarantine that we're still in some places. Of course, recently I saw in the UK, they're shutting down certain parts and there are lots more restrictions. So let's see who's on. I'm trying to navigate this as I go. So again, I'm going to type something in the box. Whoever's here, just say a nice hello for me. So welcome to my channel. Okay, and seems like someone left. So here we are in 2020, another election. As for those of you watching in the United States, we have quite a few parties, but most people just seem to know the two main ones. You have the Democratic Party, which historically has gone by the color blue, and the Republican Party, which historically has gone by the color red. You also have Independent, Green Party, and lots of different, so when you talk to people about election and, they're like, oh, Democrat and Republican, and a lot of people really don't fully know the scope of the different parties and everybody has a platform of some sort. But the one good thing that still remains in this amazing country, and I call it that, it still is, it's the freedom to be, the freedom to disagree. Some of the stuff that you see in the news with what people do in protests, some civil, peaceful, and some true rioting. You'd be killed in other countries. As a matter of fact, some of the things that we say, even your opinion, in other countries, it's grounds for some really bad punitive measures, including death. So the United States still remains a great place that people can. I would like to think our choice is to respectfully disagree. I never ask anybody who they're going to vote for. I don't want anyone to lie to me. Why should you tell me who you're going to vote for? And what exactly does that mean? So I think the good part about your vote is that your ballot it's private. It is yours. Your ballot is private, definitely yours. No one has to, I think people lie sometimes. They ask you, well, who do you vote for? And if you happen to be considering voting for someone that's, whatever term we want to call them, people may be reluctant to speak their mind because they fear how they're going to perceive. So I find that people lie often or choose to say they don't have an opinion, which I have no respect for that. Everybody has an opinion. You can choose to say, I don't care for ambiguity. You could say, I don't choose to state it, but most people have an opinion. Do you like the color blue? Well, I do. I'm just, it's so funny when you do a webcam, the lighting changes a bit. So if it bounces, it bounces back on, but it's okay. So whoever that other wonderful person is here with me, just say hello in the chat box so I know who you are and I can give you a nice shout out hello as we're here. So I may repeat this a couple times as I'm here, just in case a few people come on and they don't know who I am. So again, as Jay-Z says, let me introduce myself. My name is Cheryl Spencer. I'm a professor in one of the colleges of the City University of New York. I do a lot of things. I'm also on the board of directors of the Organization for Associate Degree Nursing. I am here in a personal category. This is my channel, but I do have representation. I'm a part of a lot of things that goes on with the nursing profession. So anybody who's on, just can you just type something in the chat box so I could say hello to you or just give you a public shout out. So again, the purpose of this video is, for me, not to do anything editorial. I'm really not even watching. Hey, awesome. Milana. Oh, can you hear me okay? Because sometimes I get a bit confused with how this works. Oh, say Milana, I hope 102 is going well for you. And yes, awesome. I know. So I'm using the webcam. I hope 102, say hello to your mom. I hope 102 is going. You can send me a private email, but if it's going awesome, you can put it right here. I hope yes, I hope everybody, tell her, said one of the best people I've ever met, your mom. 2020 has just been so, it's good, but better. Oh yeah, it is. But once you get through 102, everything else will be hard, but it's like, I put it this way: once you've been through hell, and you've been through such a rough spot and you're able to navigate and find a way to get through it. I'm not saying the other stuff is easier, but you now have had some experience. So just don't blink, just keep focusing and work on it and get through it. It's tough content, but it's important content, and it'll prepare you for the next one. So I never tell students that the upper semesters are easier. I just think that you have more experience getting through it. It's a challenge to go from 101, especially when most of you didn't get a lot of in-person experience, and I'm not sure what exactly you're getting now, because with COVID, everybody's wearing a glove everywhere, and the reality, that's not really what healthcare is. We don't wear a glove all the time, just when there's exposure, but now everybody's so overly cautious, with COVID. But anyway, so um, it's election night. And every 4 years, I think you're over 18, right, Milana? Yes. I know it. That's why I decided to do always do a Tuesday night live. I mean, I'm just calling this, yes, 18 now. I've always voted, probably, always, because I really, I value it, in the sense, here's why I vote. It's an amazing privilege to be an American citizen. I was born in Jamaica, West Indies, but I'm an American citizen. I mean, most of my schooling is here. It's an amazing privilege to be an American citizen. I do understand that. You know, I'm a Black woman. The stuff that happens in this country, from slavery to segregation to the civil rights movement to people dying to give me the right to vote. Another reason why I vote. I'm female, born female, identify female, all the female pronouns. I am. And women for the longest time did not have the right to vote, and all that fight that they went to. So I'm voting because I'm an American citizen. I'm voting because I'm beautifully Black, I'm female, and also as an advocate, as a professional, as an educated woman. I understand how politics, and I don't look at politics, as, do I like this one? Do I like that one? For me, it's all about the policies. Um, both presidential candidates have a wife. I'm not trying to get that personal with them. It's not personal. It's about policies. And I think that's how I would like people to look at, what do they say, or check them, keep them, they make a promise that I'm going to do this, I'm going to do that. And then, oh, the election's over, you don't hear from them. It's just really sadly how politics is. And most times they come to your neighborhood last minute. They come to your church, they go to your school, kiss a few babies, lie, blah, 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 blah. And then they're in office and nothing happens. That's sadly how a lot of politics have been. And people just put up with that. If I vote for you once, and I've done that, I voted for a candidate once, gave the candidate a chance. Anybody else who came on, just please just type a little hello in the chat box so I can see who you are. I would give you a chance, providing you've said some stuff, you appear to have some type of character. And again, I have to say appear, because what exactly do you know about somebody who comes on TV in a nice suit and they rattle off some sweet, beautiful thing? You really don't know nothing about them. Or they say something totally inappropriate, but you can relate to it, and or not that I relate to inappropriate, but I'm just saying, what exactly do you know? So to me, it's if this person has some type of track record, which many people who run, well, whatever. A lot of people don't, their track record is actually bad, or they show up and they don't really vote. They say that they were present, and well, what does that mean? I was there when the vote was taken, but I didn't make a decision. To me, that's like worse than voting no. If you say, "Hey Cheryl, do you like blue?" And if you say, "No, I don't like blue," at least I can respect they don't like blue. But if you go, "Well, I'd rather not say," then I don't trust you, because you just I don't trust that. But this was not meant to be an editorial. So as election night is going on, and Milan and other one or two students, and other people around the nursing world are preparing for their exam. Probably for a lot of you, that exam probably means more to you than election. But at some point, this election will. So here's what's going to happen. Again, a lot of people talk politics, don't really fully understand the criteria to qualify to become president of the United States. I'd like to say that the standard is low. People talk about presidential, and it's not a requirement, whatever that means. To be president of the United States, you have to be naturally born citizens. You have to be born in American soil of some sort. You have to be over 35 years of age. That was changed at one point. You have to be 35 years. And I believe you have to live in the United States over 14 years. That's it. That is it, people. Three things to the best of my knowledge. Be natural born citizen of the United States. So that kind of knocks me out. Over 35, despite me saying I'm 21, my birth certificate will say otherwise. And last, to live in the United States over 14 years, and I met that criteria. So those are the qualifications, and we go with that. So the way I feel about voting, I feel is, if the outcome isn't what you want, there's this whole saying about, do you ever wonder that to win somebody has to lose? That's really what this. There is just no guarantee. But here's what will happen, could happen tomorrow. One or two things will happen tomorrow. Donald John Trump will be elected for a second term. Half the country will not be happy, and the other half will be happy. That's one outcome. The other outcome could be Joe Biden wins. Half the country will be happy, half the other country will not be happy. I think a lot of people are paying more attention to his running mate, Kamala Harris, the elephant in the room. She's half black. People call it whatever she wants. Her father's a black Jamaican man. Jamaican, I like that. Her mother is a South Indian woman. So when the conversation comes about African American, what's an African American? I don't know what she identifies at, but she's half black, half Indian. Whatever she calls herself, that's her issue. If he happens to win, and she will in January be inaugurated, she'll be the first female vice president of a lot of things. First, half Jamaican, half Indian, half, I mean, fully woman. There are a lot of conversations about that. But I'm okay with how the country, I think we have to trust our system. We trust our system, and work with our system. I have voted for people before and they didn't win, and I accepted it. I voted for people and they did win, and other people haven't accepted it. And it's just so tomorrow, so whatever the outcome is overnight, I hope that we can remember that this is not just us, as a healthcare provider, member of the health team. It's important to me to understand, or for these individuals in elective office to understand that, I find that some of these decisions that are made, I wonder, who did they consult? Who did they consult? What medical, nursing, occupational therapy, social work, who did they consult when they, um, make these decisions that affect so many people. But so we need to have a seat at the table. If you haven't heard of something called Nurses on Board, I know we're taking, look it up. It doesn't have to be a nursing board per se, but any leadership board that you can help identify qualities in how a nurse can affect change. I think you should look into that. You can start to affect change just being a nursing student and joining your Student Nurses Association. Your first fight could be for a fundamental student. You could be fighting for a peer. You felt that your peer was discriminated against because of color, gender, hair. We're still having that conversation. And you can fight the powers that be and try to make sure that there's equity. There's equity both for students and health equity. COVID-19 revealed a lot of stuff that a lot of us know. When we talk about the death toll of COVID, who um, who lived it? What was the vulnerable population? The vulnerable population for COVID was no different than the vulnerable population for all the other stuff: pneumonia, the flu, hypertension, diabetes. It's your older ethnicity, lack of resources, fewer visits to your physician. COVID just kind of shone a flashlight on the health disparities. So when we watch election coverage and we talk about candidates, whatever they are, whatever sweet story they want to tell us to get our vote, if the candidate you want wins, check them, remind them. And by reminding them, you have to know who your local representative is, because of course not everybody's going to get invited to the White House. I mean, who goes to the White House these days? A ball player. I mean, do you see the White House invite, let's bring a whole bunch of nurses to the White House who have saved people's life. Let's bring a whole bunch of social workers who have helped people get out of homeless shelters. No, our society seems to only send, if you're an athlete, you can get an automatic ticket to the White House if you win some champion, and then you can say, I'm not going. You know, if I get invited to the White House, I'm going. And it's not just for a photo op. Cheryl's coming, and I'm coming to talk to you about health policy, and I'm coming to talk to you about how we can find a way, to make education more accessible for especially a vulnerable population, individuals that English is their second or third language. Yes, on paper, English is still the primary language of the US, but let's be honest, we know there's certain communities English is not spoken at all. It's not spoken at all. And those individuals need care. So while I am fluent in English, I can speak enough Spanish to get around. I can read enough Spanish to understand. Under stress, Spanish is not the language for me. I'm going to go back to the language. Sometimes I wonder which I heard first. My mother spoke fluent Spanish as a child. Her grandfather and grandmother and my great grandmother were from Cuba. So who knows? So, there's some Spanish in there. But anyway, so back to health policy. This is why election is important. So I'm not here to preach. This is not church. We're not passing the plate. Your right to vote is yours, and what you do with it is yours. It's great capital. It's so important. You think your one vote plus another person's one vote, another person's one vote can make a difference. So I ask you, whatever the outcome is tonight, we accept it and do the best. So, as I'm here, I'll probably do my little Jay-Z routine in between, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. If you've always been here and come on, thank you. If you're new to my channel, welcome. I hope you stay. That's usually what I say at the end. I do videos. I'm trying to get a lot more little, small lectures, not all my content. Could be content another faculty teaches, but I'll put it in a manner that's soft. And by soft, I mean with common terms. I ask students to study their medications and study content in a way that they would be explaining to a patient. So, I had a conversation recently with some faculty, when we're testing students on HDL and LDL and total cholesterol. I remember saying, if I had 5 minutes to teach a client about cholesterol, I probably wouldn't mention HDL or LDL. I'd probably focus on total cholesterol because when a client goes to doctor, nurse practitioner, whoever their provider, and they're talking to them in that brief time about cholesterol. They're giving them a total cholesterol number. We want it below 200. Do you understand anything about fats? We could talk about good fats and bad fats, but if it's crunch time, like, listen, cholesterol, it's a type of fat in your body. It can build up in your arteries. Some people are more at risk for it. Family history, we can reduce it. Couple ways we reduce that with your diet is one. Exercise is excellent. I'm always preaching exercise. So I could say what exercise does. You have two types of cholesterol. You have one we call a good cholesterol or bad cholesterol. Some people call it a happy cholesterol or lazy cholesterol. What exercise does, it gets the happy cholesterol happy and limits the low cholesterol. And the last thing is medications that's called a statin. Have you ever heard of anything called a statin? So a statin is a type of cholesterol lowering medication. So talk to your doctor, your family about that. That's it. That's how I want to teach students when I say soft. I want you to try to understand medications in a manner or content in a manner that you would be able to tell it to a client. Of course, I know Milan is going to tell me, but Professor, when we get the test, they use all these big fancy words and we have to understand them, hyperlipidemia, low density, and it's these types of terms. But at some point after studying the big polysyllabic, you know, big words, like, pharmacodynamics, pharmacokinetics. Who says that? Who talks like that? The average patient's like, why am I taking this medication? You know, why am I taking this medication? Is it going to kill me? That's what patients ask you. It's like, for instance, if I were to explain to a patient um, heparin, for instance, at no well, your assessment initially would tell you what the patient's cognitive ability is about, how they like to learn, if they have any experience with healthcare. I mean, I could explain to a patient everything about heparin without ever using the word anticoagulants. I mean, patients in the hospital, do they really need to be Googling up anticoagulant? I'll ask them, as much as I don't like to use the word blood thinner because that's not how it works. And I know I've been on this soapbox before. It's not like blood is like jello and you give it some anticoagulant and then it like lemonade. you know what they do is they alter the properties. They alter the properties of the medication so it takes longer to clot, etc. I know some people don't even understand that, but anywho, I could talk to a patient. So again, as much as I don't like to use the word blood thinner, perhaps with a patient you probably do because it's a layman's term. Patients like, you ever heard of a word blood thinner? They go, oh yeah, they give me this and it makes me bleed. And so you can explain to a patient, whatever the patient's name, salutation. You're on this medication. It's an injection. We give it into your abdomen just because it's supposed to go in fatty tissue. And patient may say, girl, go right ahead. I got plenty of fatty tissue there. Whatever relationship the patient will allow you to have that conversation. They could explain to them the purpose of this medication. It's, first of all, I always tell them, despite the number, the like 5,000 units, it's really a small dose in the big scheme of how heparin is. It's a small dose. And what this does, it's to help prevent. It's to help prevent a blood clot in your vessels because you're on bed rest and you're not mobile as much as you want. So, on my channel, I'll hopefully do more of those as I get a chance. With COVID, you're inside. I should have more opportunity, but life still goes on. Life still goes on with what you have to do. My schedule for tomorrow, Wednesday, I have 3 Zoom meetings already. I have 3 Zoom meetings. One, I'm probably have to bounce out of one to go into another one. So, it's just, I'm so zoomed out. I knew Zoom before COVID. So Zoom is not new to me. But now with Zoom with class, Zoom with other obligations, work, family. I'm totally, totally zoomed out. I don't know about you. And plus, wearing this mask, it's just, I'm trying as most people are, but I don't have skin problems. Now this mask has been irritating my nose in the daytime. But in the big scheme of things, I have nothing to complain about. I'm healthy. Um, my family's healthy. I could complain. 2020 has been a year that I would like to erase from my memory in more ways than one. But anyway, so Milana, since you're here, back to that test. Let's see, as we talk about election coverage, uh, what's on exam tomorrow? Is that exam number 2 for you? Let me sip some water. It has a little tea. It's water, just sugar. Exam number 2, and the content. Good luck with that. I think you finished fluid electrolytes, right? What's on this? Oh, is this all the GI? Oh, respiratory. Ooh, ABGs. Oh, respiratory acidosis and alkalosis, metabolic. Look up that bicarb. There are lots of videos out there on those. Um, I think hepatic disorders. Oof. It's like the whole human body. Sorry. Yeah, it's usually just various. So you have to do your whole A, B, and C, and assessment. To me, I think a lot of that is really assessment. Were you taught any tips on how to quickly differentiate between the three, or what to teach a person? A person comes in complaining of symptom da da da. I wouldn't test you that way, but I'm sure that's some things you have to memorize. A patient says, "Oh, you know, my husband took me out to a nice restaurant for dinner to celebrate our 3-year anniversary. Patient comes in complaining of ABC. Which of the following do you suspect?" Does that sound familiar, Milana? As see that? As opposed to, see, 25-year-old male who works as hmm, a waiter as a so those are time works as a waiter. And let's say this person, um oh yeah, a 25-year-old male works as a waiter at a local restaurant, and for the past 6 months, since this person is working there have been an increase of patrons who complain that they're sick, right? um, um, what type of hepatitis do you think that they're sick, or what are we suspecting, Milana? Because this waiter is not doing something right or doing something, um, you know. So yeah, so that's those kinds of stuff you talk about. So with we talk about food, feces. I always with all my F's. I'm trying to figure there's another F when I talk about that. I talk about my F's when I talk about fiber, fitness, fluid and fiber for constipation, for GI. I don't think it's just hepatic. So hepatic disorders. So here's another one again. I'm not your teacher, but as you're talking about election coverage, think about, is there any skin assessment that you could, anything on the skin that would bring your attention to perhaps a person of some type of hepatic disorder? That would be something easy. Um, both our candidates in election are pretty, they're over 70. So look at their skin. I mean, I know they have good health. They have good health care, better than most Americans. But so if you talk about your hepatic disorders, skin assessment is important, correct? Certain things, especially with the P word for hepatic disorders. So skin assessment, want to think about that. If you're talking about hepatic as well, hepatic, what's the organ we're talking about? So if hepatic, if you think about the organ that's involved, think about on a good day, what that organ does. So if you have a person with a hepatic disorder and that organ is now compromised, that individual now doesn't have the best ability to do what it normally does. And I'm deliberately not saying what the organ is because I want somebody to say it as they go through this. If I say they don't. So that's hepatic. So we've talked about that, the organ. Then I would definitely talk about the connection between that primary organ and the brain, right? So any type of hepatic, there's a primary organ, but also talk about the connection to the brain. So a mental status assessment would be definitely as part of your assessment for an individual with any type of hepatic disorder. Beverages at the bar, tipsy bartender with your hepatic disorders, depending on what they are. So part of your assessment, again, as a nurse, you're not doing a medical diagnosis. I call it medical suspicion. You're doing a medical suspicion based on what they tell you, what the criteria. So I mean, right away, of course, I know you talk about abdominal assessment, but when you're talking about hepatic disorders, I definitely would include a skin assessment. Definitely skin assessment and the connection between hepatic and brain, mental status, and also definitely your renal. So if you think about, and I think that's really what, if you just bring it back down to a lower level or a fundamental level in the sense. So again, as you're going through this, so I was waiting to see anyone. So again, so if you're talking hepatic, you're talking about the liver, right? So, the liver on a good day metabolizes medications. So now you have a liver that's impaired. And if it doesn't have the ability to fully metabolize, these individuals now are prone for some type of toxicity. So if you imagine this compound with somebody elderly, like, over 70, both presidential candidates or in the United States are over 70. And again, impaired, diminished liver function, diminished kidney function. I didn't say failure, diminish, impaired as part of aging. So these individuals would have, coupled with some type of hepatic disorder, may have a lower ability to metabolize drugs, and with that result in toxicity of that in the blood. And okay, so we talk about whenever when I hear about hepatic, I always think, of course, of ammonia level, right? So think of ammonia level, and I would, as a nursing student, you should know what a normal ammonia level is. You should know how to assess ammonia level, and you know that with any type of ammonia level, it could be an altered mental status. You should also know how they get rid of ammonia in the gut. With K-exolate is still the drugs that's used, and diarrhea, and gets rid of water and gets rid of that in the colon. So those are some of the stuff. I know you focus on, hepatitis A, B, C, which PPE I use. Oh, that rhymed. A, B, C, which PPE. But also don't forget about the basics with that. So of course, alcohol. So I think that's all I have for you on that, Milana. That's all I can think about hepatic. I mean, I don't lecture on it, but just work through that with what you get. Now, yeah, so back to our election. So again, it's election night 2020 in the great United States. It's a country that has been amazing. I wore a little blue tonight, little white, little red lipstick. So if you're new here, so if you're new here, my name is Cheryl Spencer. I'm a professor, one of the College of the City University of New York. This is my personal channel. So I'm not here representing work. It's my personal channel. I put up, videos, current events, tips on how to study. I'm trying to get some more lectures, just PowerPoint over. There are tons of YouTube channels. Tons of YouTube videos out there. I don't need to put up another video of respiratory acidosis. There are plenty of respiratory acidosis. I mean, I could drop some names, but I didn't come here to promote anybody's channel. I'm just trying to learn this YouTube thing as I get. I feel like I'm blending in the back with my white coat. It's a good thing I had this on. So, so as I said, it's election 2020, and I'll repeat what I said before. I believe voting is such an amazing privilege in this country that I live in. In other countries, you can't. You're not free to speak. I think speech should still be respectful of the other person. I don't have to agree with you. I mean, I disagree with people about lots of things, but I don't want you. You shouldn't have to feel as if you have to hide your thoughts because somebody's going to disagree with you. And I think that's what has happened recently with votes and candidate. If you tell somebody that, oh, I'm going to vote for candidate B, they're like, well, why would I vote for candidate B? So then that person goes, okay, fine, I just won't say anything. I make my statement at the polling place. Your vote is private. Your voting, whether you vote or not, is public. People can go up and look and see whether you voted or not. I have voted in every single election since I became available. So when people go, oh, go out and vote, go out and vote, I find that they're just telling you to go out and vote because they're hoping you vote for who they want. Um, so I just think it's a privilege, unless there's some extraordinary circumstance where I can't get to the vote. And believe me, 2020 has been one of those years where a lot of people um, yeah, it's just been one of those years. Like I'd like to erase 2020. I'm trying to find some good, but we're still here. Um, so here, like again, do you ever wonder to win somebody has to lose? That's really just the best that I can say. So two options for election 2020. Donald John Trump wins a second term. Half the people in the country that voted for him will be happy, the other half will be not. Joe Biden, with his running mate Kamala Harris, will win. Half the people voted for them will be happy, the other half will not be. Again, I think a lot of focus has been the on her because it'll be a lot of bursts, glass ceiling. Kamala Harris, if those of you don't know, her father's a black Jamaican male, so black Jamaican male, whatever. And her mother rather is a South Asian woman. I believe it says her mother died in 2009. I don't really follow much on her, to be honest, but there's stuff in the news. She's married. Her husband has 3 kids, and yeah, so she'd be a lot of first woman, first. I don't know what she identifies as, but her father's a black Jamaican. Her mother is a Asian woman. South Indian woman, Asian, of course. So yeah, so tomorrow, let's see what the news says, and I just hope people, again, just accept that this is our process, our process. But anyway, you need to check them. Whoever wins, whether it's the candidate that you voted for or somebody else, don't just forget election night. And I mean, I remember 2016. I remember 2016 like it was yesterday. I remember people wanted to have conversations with me about the 2016 election. They made some assumptions about me. They were asking questions, and my answer, my vote is private. My vote is private. It always will be, especially to some random person. Or, I mean, the people you work with. I mean, they're people you work with. I mean, they're people that I work with that I'm happy that I don't see them when I leave the building. I don't really care if they're trolling my channel and they see that. Hey, welcome to my channel. I hope you stay. It's at the end of the day, yes, you can apply for a job and actually meet one or two coworkers that you mesh with. And I've had people that I've worked with that I actually call friend, but most of the people that I work with, they're not my friends. I mean, we can't even get along on basic work stuff. So why would I want you as part of my personal life? And that's fine. And that to me is the great thing about your choice. When I keep work, it should be separate to a point. Yeah, I don't make any apologies about that. There are people that I work with that I'm very grateful that I do not have them in my personal life. Once I leave that building, we're done. I don't email you. We're done. But on the other hand, I've had friends that I've, I mean, God, my goodness. Yeah, somebody, a couple close friends that I've met from work. And that's a good thing. So, again, we're coming on about 40 minutes into this beautiful stream. And, I probably will watch a little bit of it. And, tomorrow morning we'll see what the electoral college, what the votes say. And even that, people have, concern about it should be one per person. But, some states are more populated than others, such as the great state of New York, California, Texas, a big state. I mean, it's a big state, but it is what we have. So, ladies and gentlemen, lastly, I'll say this again for those of you who have been on my channel for the past year and have actually helped me get to where I can do this live. I truly appreciate it. And my name is Cheryl Spencer. I'm a nursing professor. I am an advocate, and I try to be a good human. So as election night comes, November 3rd, 2020, whatever the outcome is tomorrow, be it the incumbent wins a second term, or Joe Biden and his running mate Kamala Harris wins, and in many ways we'll have lots of different news outlets and stuff talking about what the significance of that is. I ask that you remind these individuals that you vote for and their policies. Don't be fooled by any of their talk. That they must put their pen where their campaign promises were, and make sure that nursing and those individuals seeking health care part of the conversation, and that there's some type of equitable distribution of our taxpaying money, where those who need care is balanced by those who are paying for the care. So, and that's just really, what I want, a fair system when someone gets a vote and a chance to do that, because it is a privilege. So again, I'll end it here, and I wish you wish you well. Milan and everybody else, I wish you the very best in your exam number 2. I know some of the students are retaking a math calculation exam tomorrow. And any nursing student who happens to come up on this video, I wish you the best in your nursing process. And for those nurses who are on and family members, listen, I wish you the very best. I wish you a always safe, and a healthy week. And as how freedom allows you the freedom to be. Let's hope the freedom to be exhibits itself in sensibility. So, last time, thank you to my regulars. I have regulars now. And if this is your first time to my channel, welcome. I hope you stay. Have a good day.